Good afternoon. I'm Fontana Mayor Aquanetta Warren. Welcome to the City of Fontana. It's an honor to have you here. I want to thank Governor Newsom for his role in fighting COVID-19. California has led the nation's fight against COVID-19 with early, robust public health measures that has helped to save countless lives. In Fontana, we remain focused and ready to adapt to the evolving pandemic. I would like to introduce my friend and colleague, Congresswoman Norma Torres.
Thank you, Mayor Aquanetta Warren. It is my pleasure to be here with you once again, standing in the city of Fontana. It is a special day for us in the Inland Empire because we get to introduce and welcome our wonderful governor of California. And before I bring you up, I just want to thank you. Thank you for saving our lives through this pandemic. We know that it has been a very, very rough 2 years, but you have done everything in your power, working with federal officials at every level. And I thank you on behalf of the residents of the Inland Empire for everything that you have done. Bienvenido a la ciudad de Fontana, Gobernador Gavin Newsom.
Thank you. Thank you, Congresswoman, and let me thank everybody for taking the time to be here, particularly those that are about to speak. Madam Mayor, in particular, let me extend my gratitude and appreciation to you for the privilege of having us back here in the Inland Empire and being here in particular at one of our two warehouses that is leased by the Office of Emergency Services, a warehouse, this warehouse in particular, roughly 1 million square feet, which now is housing a demonstrable example of our preparedness as we move into the next phase of this pandemic. A warehouse that did not exist 2 years ago. A warehouse that now has been replicated in other parts of the state, some much more modest in size and scope, allowing us to have the confidence to be more assured that we are prepared for the uncertainties, the things that are about to appear and yet to come as it relates to the vagaries and the challenges associated with this pandemic. You know, this, as the Congresswoman said, has been a remarkable 2 years for everybody. No one has been immune from the stress and travail, the heartache, the devastation. But many of us have shared those burdens disproportionately, unequally. Those issues are all part and parcel of a consciousness that brings us to this moment. As we reflect not only on the 2 years, the lessons learned with humility, but we, again, prepare for the uncertainties that lie ahead. The journey we've been on, I think, only reinforces the fundamental construct and understanding that while we can't predict the future, we can better prepare for it. Why we have done a remarkable job, and I appreciate the Congresswoman's recognition as a state of keeping people alive, and I just want to underscore that. California, as it relates to largest states, one of the lowest death rates in the United States of America, 50% lower death rates in California. A state like Florida, 35+% lower death rate than states like Texas, lower death rates in Illinois and Pennsylvania and New York. I can go on. While that's been the case, and our economy has grown at a faster clip, 26% of America's jobs coming out of the state of California in December, 26% of U.S. jobs coming out of the state just this past December, we have been ravaged by this. Number of lives lost, those that have lost loved ones, those that have lost confidence and trust, not just in institutions, but often in each other. The relationships that have been frayed, those that are feeling more lonely than ever, more isolated and disconnected than ever. And so we have work to do as it relates to turning the proverbial page. And what we're announcing here today is about turning a page, moving from this crisis mentality, moving from a reactive framework to a framework where we are more sentinel in our approach, that we stand firm and confident as we lean into the future, moving away from a reactive mindset and a crisis mindset to living with this virus. We have all come to understand what was not understood at the beginning of this crisis, that there is no end date, that there is not a moment where we declare victory. Despite so many of the metaphors that were used during this pandemic, the war metaphors, where we said we will defeat this virus, there was some suggestion that that was a destination, that that was a place, when in fact, we now know it's more of a direction. And in that light, we have put together a plan that we coin as the smarter plan, because we are smarter 2 years later. We are more adaptable. We are more capable to understand the nature of this disease, the mutations, its variants, and we recognize with humility that we don't know what we don't know as it relates to the future. But we have never been more prepared for that future. And so it's in, again, that spirit of optimism that we now move into a new phase of addressing the challenges and realities of this disease. We move out of the pandemic phase, and we move into a phase which should allow you confidence that we are not walking away, that we're taking the lessons learned and we're leaning into the future. There are those that prefer to walk away, to deny the realities of the last few years, let the virus and all its forms and manifestations continue to take its course. That's not the approach we're arguing for. It's not the approach we're taking. We are taking a more sensible, and I would argue sustainable, healthcare approach based on the lessons learned to prepare for the unknown and to invest in a future where we can all do better there. And so the smarter plan is rather simple. You see the word behind me. You see the letters S, starting with the obvious, addressing the issue of waning immunity, addressing the need to continue our work, to get shots, to get doses, to get vaccines into people's arms, to get those that haven't been boosted to get boosted. And we have more prescriptive details and strategies to continue those efforts in partnership with 800 community-based organizations, in partnership with 200 mobile clinic sites through OptumServe partnerships, in partnerships with our state-owned testing lab, Valencia Labs, and in partnership with many of our schools and faith-based leaders. You'll hear from the pastor here in a moment, and others that have been on the front lines of that effort. Number two, we want to continue to do more of what you see in this warehouse, and that's prepare. You know, the warehouse, before I was telling Andy Slavin when we walked in, I said, Andy, we just walked about 6 feet. I said, these 6 feet of boxes are pretty much all we had 2 years ago in the old warehouse. And we thought that was a lot. I remember when we came back, said, we have a few million masks. I thought, a few million, that will last forever. Little did we know. The country, by the way, was not only out of masks, we at one point had more in inventory than the entire U.S. stockpile. Why did we do that? Because we went to China and we opened up our own factory, and we were able, using the market power of the state of California, to leverage the development and manufacturing of masks. And as a consequence, we started exporting masks ourselves to other states, using only that purchasing power that a state like California could advance. So masking is an important part of this. It's not just having better fitted masks, better filtration, but also making sure that we are stocked and ready if we see a more virulent mutation of the virus in the future. Issues around awareness. This is incredibly important, and this is what is novel and new. As you know, we've been doing, many other states have been doing this for some time. California has been doing this at scale. A lot of our wastewater, our Sentinel wastewater efforts have been incredibly impactful in terms of providing us an early look into where this virus may be going and its mutations. And we want to build on that and build out our network as it relates to early detection and awareness through our wastewater and genomic network. No other state does genomics better than the state of California. Of course, we're the birthplace of life science and biotech, biotherapeutics, and bioinnovation. Our genomics labs are second to none, particularly here in Southern California. We want to build out that network on a regional basis. We want to create a brand new division. We've put this in this year's budget. We're requesting this support from the legislature. We want to create a brand new, organized, strategic communication and community partnership unit to focus on mis and disinformation. We just released a series of videos, Mythbuster videos, in partnership with 250 ethnic media outlets to go after the mis and disinformation that is still a huge problem in America today and here in the state of California. But we want to do our part and not just wait for the federal government to do that. And we want to build out this unit, bottom-up, culturally competent way to, again, address the issue and needs of being able to communicate in real time and address the issue of our North Star, again, equity, to make sure all Californians are included in these efforts. The issues around a smarter plan mean nothing unless you're ready. The R representing a readiness to make sure that we can adapt in real time. And that's why we're creating a brand new unit as well, what we refer to as a statewide assessment and action unit, that, for instance, if you started to see an outbreak here in and around the region, down the road, or here in Fontana, or down the road, Riverside, anywhere in the county, i.e. all of a sudden, now we've got a team of folks, epidemiologists, Office of Emergency Service, Department of Public Health, whole cross-section of folks in this new unit, and they move in real time. They go out, technical assistance teams, they do the genomic sequencing, they do the modeling, they do the data analysis, and they work to develop strategies and plans in a very targeted effort, keeping on top of this disease in real time. That's the readiness component, and that's why we want to create and establish this new statewide unit. We've got a testing component, yes, because we have to continue to test. Now, we were doing up to 500,000 tests a day. Remember at a time we broke 1,000 tests and everyone applauded? It wasn't even that long ago. Now we're testing 400,000 or 500,000 folks a day, did 199,000 exactly yesterday. We want to keep our testing protocols up. Those are the networks and partnerships that, similarly to the vaccine efforts, we want to keep in place. As it relates to issues of education, that education is about educating our kids safely in-person instruction and not having to deal with all the stresses and travails that we had in the past. And we can talk more about, those 15 million over-the-counter tests that we were able to get in a matter of weeks, just over the course of the last month, to help keep our kids safely in school. And I could highlight the fact, I should, point of pride, 12% of American school kids in the state of California, 1% of the school closures. We're outperforming the vast majority of states keeping kids safely in school. We want to continue in that space. And of course, R represents, not of course, but maybe understandably, RX. And I'll close briefly, forgive me for long-windedness, but this is a detailed report. Been working on this for a few months. The RX represents an understanding that it's not just about vaccines, it's about what we do best, what separates the game played here versus that of any other state in the country. That's the research and development that is unique to California. And shouldn't surprise you, a lot of the development of some of these therapeutics, some of the most well-known therapeutics, happened here in the state of California. And so we want to maintain that leadership. We want to maintain that cutting edge research and development. We want to develop more partnerships. We want to develop deeper partnerships. And we want to advance through our academic institutions more partnerships that allow us to continue to stay on the leading and cutting edge, not only as it relates to therapeutics, but other new novel strategies to address this virus and disease, particularly for those that are immunocompromised and those that continue to be particularly vulnerable, our seniors, to this disease. And so the RX is also about research development, partnerships with academia, but also about innovation. We have some interesting strategies on creating prizes to incentivize new developments on air filtration and ventilation, a new task force that we're proposing in that space. We have new novel strategies to develop partnerships to drop the cost of testing. There's no reason we should have these over-counter tests costing as much money as they have, and I'd hate to see us waste this last 2-year experience and not drive those down to prepare for the future. Look, one thing this is not, and I'll close, is overly prescriptive in this respect. This plan is a long It's come a long way from our mindset of a few years ago, where we were battling at the time an Alpha variant, and then dealing with our own 2 West Coast variants, unique and distinctive. And then all of a sudden it was the Delta variant, and then we were rushing and skating to that puck. And then, of course, we go to Omicron. What I think would be a big mistake is we are overly prescriptive in our response metrics to a specific variant or disease, when in fact we know that Omicron's it's not the last variant of this disease. So we have a response net metric that is prescriptive, but not necessarily a disease metric, if that makes sense, that is specific. Dr. Galley will talk more about that in a brief moment. That's also, again, part and parcel of our understanding, again, smarter than we were just 2 years ago. I'll close on this. It was about 2 years ago where some of you were just learning about California, saying, we're not going to turn our back on Americans that wanted to be repatriated in the United States. Other governors did. Other states didn't want folks coming from Wuhan. We didn't do that. Trump administration reached out. We took the call, and we took responsibility to help repatriate American citizens from Wuhan. 221 came to California. That's when I first started to learn about this virus. It was a few weeks later, I'll never forget. I got woken up about 4:20, and it wasn't my youngest son this time. It was the president calling. President Trump saying that he's happy to now talk about that Grand Princess cruise line off the coast of California. But he wasn't so sure, he said very publicly, that he wanted it to come into California because it would increase the number of COVID cases. I remember that like it was yesterday. Trying to understand what an N95 was, surgical masks versus procedure masks. And now all of a sudden we're talking, it's like we're old hat. Antigen and PCR, PPE, PPP, loan conformity. I mean, it's just remarkable. You can pronounce hydroxychloroquine now. Or you may have more interest in ivermectin. It's just an amazing journey we've been on. But it's not been linear. And that's why we need to prepare for the unknown, but again, with confidence and more knowledge and more resources and a more resourceful mindset. And so I'm really proud of the team for working hard on this. I think this may be the first in the nation, but that shouldn't surprise you. We've been first in so many other categories throughout this pandemic, but being first, that's hard to sometimes do, because we're the first to have expressions of concern and opposition, not just support. And so, final words, being first in this space doesn't mean we're best, but it means we're a lot better. And it means we'll continue to be better. As long as we maintain an openness to argument, we maintain an interest in evidence and data and science, and we do not get consumed by the ideology that has taken over so many parts and parties in this country. That will not happen in the state of California. And with that, let me introduce the architect of this plan who worked so hard on it, Dr. Galley. Thank you.
Thank you, Governor, and really terrific to be here on this special day. I want to take a moment and thank the people who do the work every single day, people on my team at Health and Human Services, in the Departments of Public Health, our Department of Emergency Medical Services, our colleagues and partners at Cal OES, and all of the agencies in the state family who had a hand in helping us get to today. And the voices of 40 million people. We've been listening the whole time. We've been listening to what people are telling us through their actions, through their emails, through their words about where we are. And I just want to take a heartfelt moment to thank people for sticking with us. It's been a long 2 years, Governor. We've been through a lot together, and today's an important day, not because it symbolizes some lifting of some important requirement, and I know people are always interested in that, but it's really about a recognition about the need to balance. the balance between the healthy, humble respect of a virus that has wreaked havoc on our lives, that when we think we know about it, we learn we don't. It shapeshifts, it comes at us in a lot of different ways. It infects people who don't know they have it. With this sense that it's no longer a virus we don't know. We have a lot of immunity that we didn't have 2 years ago. We have a lot of knowledge and know the tools that help us get through it. So the balance of today is a lot about not moving on, but moving forward as a state. And for us in California, it's this idea of being smarter as we move forward. You saw the governor did an amazing job walking through the components of what is an acronym. Sure, 7 letters, a lot there, but there's a lot that's happened this year. And the focus that I think anchors so much of what's in the plan, and I hope many of you will take a look at it, is anchored in equity. We have, from the beginning, recognized that this pandemic has affected all of us, but some more than others. And it's not surprising that the characteristics of those people and communities are the same things that this country has worked hard, this state has worked hard to overcome. And this plan, I think, recognizes, we certainly tried to, we got advice on how to do it better, stay focused on equity, how we close disparities. I thank God for the team that's every day crunching the numbers on which communities are behind on vaccines and how we're going to get them caught up. Now, a focus on making sure older Californians, older Black and brown Californians, older Californians with disabilities get boosted. We're behind. We have work to do, and that's where our focus is. Getting our kids vaccinated, big deal. Help support the plan to keep kids, as we talked about, in-person education, but also wraps a thicker blanket of protection around this state, which we desperately need. Masking, I know, it's been a very important, popular topic. We are really proud, just a few weeks ago with the CDC, published a study that shows that we don't have to talk about whether masks work, but our focus should be on how to use them effectively and precisely. These do save lives. The higher the quality, the more likely we are to prevent an infection, to keep an environment safe. And even though we moved in California from requiring masks, we didn't move to like the first step. I outlined with you on Monday 4 steps. Let's not just talk about optional versus required. Let's talk about recommended and strongly recommended. In California, we strongly recommend you decide to keep your mask on when you're in indoor high-risk places. And that's going to continue until we see the signals that it's okay to recommend it and then make it optional. So it's not just a single level. So we're getting more sophisticated. We're talking about things in a much different way than we did before. The governor alluded on awareness. We're really proud of the work California has done to accelerate our level of awareness. Our antennas are up as high as they can be. We're doing things with wastewater that we didn't do at the beginning of the pandemic. That's because of the investments that we've been able to make because of the governor and so many others who've allowed that to happen. But what does that mean? It doesn't just mean that we get to tell people what the new variant might be or if it's an old foe that the governor mentioned, which those are. But if it's a new variant, do our medications work against it? The same ones. We've learned the hard way. Monoclonal antibodies worked on Delta that didn't work on Omicron and vice versa. We need to know immediately or as quickly as we can with our partnerships with the CDC and others what works and what doesn't. Same thing for our tests and same things for the vaccines. We know that it's not about getting to immunity. That was our old phrase. It's about keeping up your immunity. And we're going to need to keep updating folks about what we're doing. We need to, in the case the governor mentioned, if we see a signal here of increased transmission in this region, we've got to flood the zone with tests. We've got to be able to do that. And warehouses like this, not just PPE and masks, but tests as well, to be able to bring them quickly to a community to make sure we stay on top of it. Then efforts to increase the preparedness of hospitals. We're committing to having 3,000 staff members called into the state within a couple of weeks of need because we're keeping those contracts that have been so important to helping us get through the surge. We hope never to need them. We're making incredible investments in California's workforce, but we know 2 months from now, 3 months from now, we may need to bring staff in, and we're going to be ready for that. And the governor talked really nicely about the communications and the partnership with community-based organizations. Being ready and aware means being able to communicate clearly. And we've all learned a tremendous amount about that. I will be the first one to admit it's been hard. It's not always easy to get a moving message to land clearly with all of you, all of the public, but we're doing a lot to improve, to engage folks that are around me, that have the trust of their local communities, that know the needs and the way to speak about something as complicated as COVID-19 in its many forms. We're also committed to updating the public in a different way moving forward. We've had to have pages and pages of guidance explaining what to do today, how it's changed, why we're asking you to do it, and we're going to move forward with hopefully a simpler way of doing it. In many ways, it's the COVID smarter ABCs that we're going to, as a state Health and Human Services family, update our public and hopefully working with all of our local partners to simply put on 1 or 2 pages, what do you do about masking? What do you do about vaccines? What's up with treatments? What are we doing with isolation and quarantine? And what are our recommendations on testing? I know, true story, my mom periodically asks me what she needs to know. And I can in 1 minute tell her. Why can't I do that for everybody else? We should and we will, so that you can stay on top of it. We're not asking you to go to 20 different sites. We're going to work with the information that the CDC provides to do that thoughtfully and well very, very soon. And I'll wrap up by revisiting a little bit of what the governor leaned in on. We not only follow the science, in California we make the science. We have incredible scientists, researchers, clinicians, engineers who are doing everything to improve indoor air quality. I'm really excited about the work we're announcing in that space, long overdue. The work around innovating testing and making sure not just how do we make the antigen tests of today, but how do we make the different tests of the future? And not that the state has to do it. It's about our partnership with others and inviting them into the assets we have to really help support the creation of something new and different. And then, of course, coming back to the concerns around equity. And Governor, I remember early on when we were invited to partner with the then Trump administration on therapeutics, when we just had 1 or 2, and we were invited to set up some monoclonal antibody infusion sites down in Southern California at the height of the winter surge a year ago. And we said an emphatic yes. We invited, it started as a few, it grew to about 15 in Southern California today, maintaining over 20 sites, even after the federal resources left. But we leaned in heavy on treatments. And as I sit here today and we look at the power of the vaccines and the reminder that even if you're infected after having the vaccines, you're so much more protected. The chance of you going into a hospital bed are small, and that's the important power. But really, the combination on the one hand of vaccines and mitigation efforts and treatments developing on the other hand, I think really give us a path forward here to no longer have to live in fear, but to really be smarter about how we approach this. And I think, Governor, I appreciate the recognition for the team's hard work on this plan, but it came with partnerships with so many people, not just in state, county, local government, but experts and people really studying how this pandemic works across the nation, across the globe. What are the trends that California needs to pay attention to? I wish it was something we all could do on our own, but I'm grateful to have amazing helpers along the way. And among those is the next person I get to introduce, Mr. Andy Slavitt, a Californian. He lives here in Southern California. Somebody who's advised, worked in the Obama administration, advised our current president and his team on how to move forward in the pandemic. And somebody that I know has been rooting for California the whole time, not because it's just about him. But because I think Andy knows that with California leaning in, leading the way in some ways, joining other states that also lead, we can get through this saving the most lives possible. So it's my pleasure, Andy, to invite you up.
Thank you, Dr. Galley. Thank you, Governor. You know, throughout the past couple of years, the one thing that's been clear about California is it stayed ahead throughout the entire time. I don't know how many times, Mark, you called me or I called you over the last 2 years with some problem, something brewing somewhere in this state or in another state. I remember distinctly a problem on the border in Texas. And I remember calling you and saying, how did you handle this here in California? And suffice it to say, it was not how they were handling it in Texas. It was not getting people, no matter what they looked like, no matter where they came from, no matter their circumstance, the medical care they needed at that moment. And you know, throughout the pandemic, I just want to thank you. And I know that on behalf of Washington and the White House, to thank you, Governor, for taking the lead. You know, it's not by accident that you have the lowest death rate of any major state. That doesn't just happen. And it begins with the great doctors and nurses and folks in the medical community here in California, the paramedics, the EMTs, the people that have shown up every day, and the people that gave them the resources to feel empowered to take care of business and to keep us ahead. It doesn't happen by accident. Along with New York, California is the only other state, the only other major state in the country with vaccination levels that rivaling the best countries in the world. And it's not lost on any of you that California has vaccinated more people than 7 or 8 European countries combined. This has been an enormous undertaking. Just look around you. This is an enormous undertaking that they've had to start from scratch. And so this leadership, I think, continues now with this plan, but it continues, I think, most importantly, with some of the words that Mark and the governor both said about an understanding of what we're facing. We have an enemy. The enemy is not each other. The enemy is not another political party. The enemy is a wily little virus. Now, there's a few things we know today about this virus that you heard from both the governor and from Mark. Number one is it is now something that our bodies have seen before. We can't call it novel any longer. That changes our strategy. Number two, it is something that we now know preys on people who are on the margins, people who don't have access to the resources, people who are underrepresented. If you're older, if you're poorer, if you're sicker, if you live in communities that have fewer access to resources, it preys on you. And so while there may be people in other parts of the country that say, hey, it's time to move on, because the majority of us can start to feel safe, because we can work from home, we don't have to work by the hour, we don't have to work that second shift that puts us in exposure with all these other people. In California, that's not what they're saying. California's saying we can't move on until we can help everybody move on. And that's so powerful and such an important part of what the state has always represented. That's why my wife and I moved back here. But what is this plan at its core? What is this plan? This plan is an investment. It's an investment in the people of the state. I can tell you that it is very tempting for a governor and a state that has so many other priorities and so many other things on their mind to say, can we just get a breather? Can we just not focus on the pandemic? Cases are starting to drop. Let's just put it out of our head and work on other things. And it's very tempting. It's very tempting. It's very challenging. And what this, in fact, says is we've got to find a balance. We've got to find a balance. We've got to tell the truth about what the threats of this virus are, and we've got to stand up to it. And the most important elements of this plan, and all of these things, there's a few things that shine through. Reacting quickly, having the who, what, how, why, where, and when of what to do when we do see another surprise, so that the public doesn't have to worry about it. And number three including everybody, making sure that everybody in the state feels that there's an answer for them in here. So I'm incredibly proud, and thank you for asking me to be up here. This is going to be a model, I can tell you already, for what other states are going to begin to do. The smart ones, the ones that are going to be smarter. Maybe not smartest, but smarter. So anyway, thank you for having me here. With that, I want to introduce Dr. Sanchez to come up next.
Well, thank you very much, and I'm pleased to be here amongst all these great leaders here in California. I want to thank the governor for his leadership during this pandemic. We were the first to act in many ways, and California's response to date has saved many lives. The governor is showing his leadership again through this plan. As a physician, I must be prepared to address whatever comes through the door based upon my knowledge and tools at my disposal. This plan is designed to do the same thing, using what we have learned over the past 2 years and applying those tools and knowledge to what COVID might throw at us next. While we might not know what the pandemic has in store for us, we know what works: vaccines, masks, testing, treatments, and that's what's in this plan. We know that we need to be prepared for the unknown with the ability to get supplies out to communities quickly, bring in new staff to minimize the strain on our healthcare systems, and to quickly identify new variants. The plan also acknowledges that this pandemic affected some populations more than others, such as persons of color, persons with disabilities, and older Californians. We must be prepared to double down in communities that are most in need. It also recognizes that this is just a state effort, but is going to need the assistance of local community partners to reach and provide assistance to people where they live. The last couple of years have been very difficult, but with this plan, I believe we're continuing to turn the corner in our fight against COVID. As a physician, I have seen the huge toll COVID has taken in our communities, and I'm glad we have this plan to keep us moving forward and stay prepared. Now, I want to do the same thing in Spanish for those that speak Spanish, for a Spanish-speaking community. Quiero agradecer al gobernador por su liderazgo durante esta pandemia. Fuimos los primeros en actuar y las respuestas de California hasta esta fecha ha salvado muchas vidas. El gobernador está mostrando su liderazgo nuevamente a través de este plan. Como médico, debo estar preparado para tratar cualquier enfermedad que entre por la puerta, basado en mis conocimientos y herramientas a mi disposición. Este plan está diseñado para hacer lo mismo, usar lo que hemos aprendido en los últimos 2 años y aplicar esas herramientas y conocimientos a lo que COVID-19 podría ahorrar a nosotros en el futuro. No es posible que sepamos lo que la pandemia va a traer en el futuro, pero sí sabemos lo que funciona: vacunas, máscaras, pruebas, tratamientos, y eso es lo que incluye en este plan. Sabemos que tenemos que estar preparados para todo, con la capacidad de llevar recursos a las comunidades rápidamente, traer nuevas personal para minimizar la tensión en nuestro sistema de salud e identificar radicalmente nuevas variantes. El plan también reconoce que esta pandemia afectó a algunas poblaciones más que otras, como las personas de color, personas incapacitadas y personas mayores. Debemos estar preparados para asistir a estas comunidades cuando lo necesitan. También reconoce que no es solo un esfuerzo del Estado, sino que ha necesitado la ayuda de los socios de la comunidad local para llegar y brindar asistencia a las personas donde ellos viven. Estos últimos 2 años han sido muy difíciles, pero con este plan creo que vamos a ganar la lucha contra el COVID. Como médico, he visto el enorme número de víctimas que COVID ha afectado en nuestras comunidades y me alegro de que tengamos este plan para seguir avanzando y quedarnos preparados. Gracias. I want to introduce Pastor Casey.
Good afternoon. Pastor Sam Casey, Executive Director of Congregations Organized for Prophetic Engagement, as well as the Senior Pastor of New Life Christian Church in the city of Fontana, California. We're excited to be here today in recognition of the courageous work of one of the greatest governors here in the state of California with the SMARTER plan. As community partners, we engaged in the fight against COVID in the earlier stages. COPE, along with the Inland Empire Concerned African American Churches, as well as Loma Linda University and the County of San Bernardino, with support from the state, engaged in testing, bringing greater awareness, as well as making sure that some of the most marginalized communities had access to not only testing, but more importantly, the vaccination and boosting process. Currently, we're still engaged in that fight. That's really relevant to the SMARTER plan. We've helped individuals get shots in their arms. We've provided recently some 7,000 N95 masks to our congregants and community. We've also passed out another 15,000 take-home COVID tests, continuing to create greater awareness in our community about the falsities and the negative things that come along with better understanding this process. So I agree with this SMARTER plan, not just because I'm a resident of one of the best states in this country or the city of Fontana, but I believe it's an opportunity for us to continue to save lives, and let's do it in a way that makes us smarter. And so we salute our governor, we salute our mayor, as well as our congresswoman, and certainly the Public Health Department of the state of California. We salute them in their efforts. And with that being said, let me just encourage our educators, our healthcare workers, and those who are standing on the front lines, especially our scholars in school. Let us not be weary, the sacred text says, in well-doing. For if we continue in this process, we should not faint. Let's stay smarter, let's stay encouraged. And at this time, I'll turn you back into the hands of our governor for questions and answers. God bless you.
Thank you, Pastor. God bless you. Well done. Thank you. The pastor should be answering the questions. Happy, of course, now to answer any questions. We can hear you, though. Uh-oh. Well, I'd point you to Dr. Galley's press conference 2 days ago, where he laid out in very specific and detailed terms the composite indicators that go directly to your question and an appropriate response. I'll say this as a parent of 4 young children. I know a thing or two about the nuances and the complexities of the issue. I also am very familiar with what's going on across the rest of the nation. There are 13 states, you may be familiar. We are among 13 states that have not ended their school masking requirements. Just today, the governor in Washington State announced prospectively that he would be ending it on the 21st of next month. We have stated very clearly that on the 28th of this month, we will be announcing a specific date, that date with destiny. The masks will come off, and we'll do it in an appropriate manner. We continue to consult with parents, most importantly. And I can assure you this, there are parents that have strong opinions. Yes, you're correct on both sides of the issue. And I can assure you as a parent, I understand that. And we have to accommodate for a state that has more schools and public school educators than any other state in the nation. And the nuances and complexities that provides, those challenges, all have to be incorporated. And that's why we feel very confident that on the 28th, not only will we announce a date, but the date will be well within a period of time that I think will do justice to the needs to keep people confident that their children are being prioritized and healthy and safe, at the same time to accommodate the understanding that we're trying to promote today, that we are moving into a new phase of this pandemic.
You curtail the lies and the half-truths about the pandemic?
Well, the platforms are of concern, of course, and platforms have to do a better job across the spectrum, but there are also those that are propaganda machines that are out there as well. Let's be candid. I don't know if you've taken any time to see InfoWars or The War Room and Steve Bannon. Spent the weekend, I watched his interview with the My Pillow guy. Incredibly informative. One American News, you're familiar with them down here. Perhaps one of the great disinformation networks in America. I'm not just referring to Newsmax or the primetime propaganda lineup at Fox News. And all of their pundits that safely have been boosted and fully vaxxed that continue to promote a lot of misinformation. And forgive me for being so pointed and candid, people are quite literally losing their lives. It was a tragic example of that just yesterday. A state trooper in Washington State who quit because he couldn't take it anymore, just lost his life because of those propaganda networks, because he was believing what was being stated and spread. So we have a team of people, to your question, at the Health and Human Service Agency. In fact, a couple folks right here are working on this, have been for months, that go out and are battling. They're in the trenches. They're on social media, not just the well-known platforms, but increasingly well-known, as apparent, TikTok platforms and others trying to push back. But what we're doing in the Smarter Plan specifically is we are creating a brand new unit in state government. It's a strategic partnership unit and communications unit that's going to work full-time on this. And we put out this week in our Vaccinate for All campaign, in partnership with 250 media outlets, these myth-buster videos in a culturally competent way to take our efforts to go after the mis and disinformation to a whole nother level. So that's how we're going to approach it. We'll continue to call it out. We'll do our best, and we ask people that continue to promote lies and misinformation to stop. People quite literally have lost their lives because of that promotion.
Hey, Governor, Phil Schuman with Channel 11 News here in Los Angeles. You gave us a lot of information here.
Forgive me.
Is it possible you could highlight what you feel is the most important thing for people to know out of that acronym?
I think what I want to know is we have your back. We've learned a lot. We're not approaching things the way we approached it last year, certainly not 2 years ago. We are moving past the crisis phase into a phase where we will work to live with this virus, and we will maintain a readiness posture and stay on top of the nature of change that is so self-evident with this pandemic and disease. And we are moving in a vernacular away from a more control construct of mandates to one where we create the conditions and an environment where we are not reacting, but we are maintaining a posture where we are staying on top of the mutations, top of this virus, and making sure that we are communicating more effectively and targeting our interventions much more prescriptively than we have in the past.
Good afternoon, Governor. This is Aldon Thomas Stiles from California Black Media. Governor, you're in Southern California today, and I'm wondering if you have a reaction to SoCal Gas's announcement this morning that they plan to bring green hydrogen into Southern California to replace natural gas and other fossil fuels.
Well, I happen to be very familiar with that, only because there's no bigger issue outside of this issue that brings us here today than the existential issues of climate change, and no state more responsible for addressing this issue in the state of California, because no state's more impacted by extremes in the state of California. What more evidence do I need to give you than your 90-degree weather down here in the last week, and the 37, 8, 9, 10 days that we have not had any significant rain in the state of California. Again, February being allegedly, traditionally, the most wet month of the year. And so we put $37.6 billion in our budget to address the issue of climate change. That's nation-level budgeting. One of the areas we focused on is hydrogen. One of the areas we're focusing more attention to is green hydrogen, particularly as it relates to manufacturing and large industry. And so I want to just acknowledge what Southern California Gas did today as a step in the right direction. They're promoting something the state continues to promote and will be promoting more over in the next number of years. And so we're grateful by that example. We need to see more of it, not only from them, but across the spectrum. But the issue of addressing heavy industry, not just residential solar, not just wind, not just a conversion of electric vehicles, but really going after big industry is critical in advancing our efforts of low-carbon green growth.
Hi, Governor. Thanks again for taking our questions. I'm Tom Waite with CBS Los Angeles. I was wondering if you're aware, there's a bit of a feud going on between a couple of the LA County supervisors and the LA County Health Department, where the supervisors are upset that the county is not in line with the state in terms of the indoor mask mandate. Obviously, the state lifted theirs, but LA County still has theirs in place. So what's your position on that feud? What should the county be doing, and how would you resolve it?
Yeah, well, I don't know enough about the details of the feud to get in the middle of it at the moment, but forgive me in that respect. But look, as a former county supervisor, I've long maintained, and you've heard me say this on multiple occasions, localism is determinative. And I'll remind you, as I do often, but it's important. California is the size of 21 state populations combined. There's just nothing else like it. If you put a circle around just LA County, it's a small dot in California. It's bigger. I mean, you put a map, 2/3 of the rest of the states are not as big as just the county. So I deeply understand the nuances and complexities. There's 58 counties, 476 cities, different geographic challenges, opportunities, 80+ cities just in the county, different approaches, large, smaller cities. So it's understandable there'll be some differences of opinion. The state provided that support long ago in the beginning of this pandemic, and we're maintaining that in the Smarter Plan, that we want to allow that local flexibility. We think it's critical. I'm very pleased with the state mandate that was lifted as relates to indoor mask wearing. The overwhelming majority of counties, I think anywhere from 52, 3 or 4 of the 58 have aligned with California, and I anticipate others will follow suit. But some counties, and obviously LA is one of them, may take a little bit more time, but I'm confident they'll get there very, very shortly.
Hi, Bo Yarbrough, Southern California News Group. Circling back to the green hydrogen thing, do you think the new pipeline is going to impact the closing of Aliso Canyon?
Well, that's a good question, open-ended question. I just learned about this, and obviously the application will be in front of the Public Utilities Commission, the CPUC. I'll have a chance to review that. Obviously, the commissioners will take a look at that. But we want to move forward with closing of Aliso Canyon. We've been very crystal clear about that. And in fact, I expressed some frustration that it wasn't happening fast enough. So I'm hopeful that this will advance that effort. And I think there's some wisdom to this move by SoCalGas, because I think it's an acknowledgement of the future. The future is much more bright for a company that adapts to the future. And I think they're understanding that they're an infrastructure company, perhaps more than they are a gas company. And I think that's a preferred pathway. And so I'm not here on their behalf as a fiduciary, but I am here on behalf of all of us, trying to clean our air and deal with the extremes, extreme heat, drought, and wildfires. And we need to move past fossil fuels. We need to move past worrying about what Putin does and the impact of our gas prices, and move past our dependence on gas and oil. And I think this is at least a positive step in that direction.
Thank you.
Hi, Governor. Shelby Nelson with KTLA. Most of my questions have been answered, but I just wanted to go back to that question about students and masking. Specifically here in the Inland Empire, we have seen kids and parents protesting. I know you answered some of those questions, but what would you say to parents that are really just enraged seeing these huge events with thousands of people not wearing masks, and yet they still have to send their kids to school with masks?
Here's what I'd say. Look, I understand that, but I also understand this. California, 92, almost 93% of all adults 18 and over have received at least one dose. 71 million doses total in the state of California. Of all Californians eligible, we're about 74% have fully received their dosing. Kids, that's not the case. Sadly, it's 29% of 5 to 11-year-olds are fully vaccinated, not 75. You know, we were able to avoid, as an example, what Texas and Florida could not avoid, and that was a substantial number of kids, pediatric hospitalizations. We have a substantially lower number than those states because of the approach we've taken. That's why we're not alone in that approach. Many other states still maintain their mask requirements, as I noted, 13, I believe, plus the District of Columbia. 8 have announced an end date. We will do the same, and that's what I would tell those parents that are concerned. We'll do the same in just 11 days. And we're trying to do our best to keep their kids safe and healthy, keep them safely in school, and we've outperformed many states because of that, and we believe the masking has helped. And we believe there's no substitute for in-person instruction in that respect. So, look, this is challenging for all of us, and I'm not naive to that critique. As I said, I'm a parent of 4. My own kids have strong opinions, not just their parents, not just parents across the state, but we're very, very close to an announcement that I believe is an appropriate one under the circumstances.
Hi, Governor Newsom. I'll be the last question here. I'm with 91.9 KVCR out of San Bernardino. Could you say in around 30 seconds why this announcement should matter to the common Californians?
Is that all you have on the tape, 30 seconds? Why does this matter? Because I think people are looking forward to turning the page. People are desperate to move past this crisis mode that we've been in for the last few years. People are desperate to get back to whatever semblance of normalcy they vaguely may remember from a few years prior. But they also need to know that we have their back, we're going to keep them safe, and we're going to stay on top of this, that we're not walking away from this pandemic and this disease. We're not walking away from the virus because the virus continues to change and mutate. And we will change our approach as the virus changes its mutations, its lineages and sublineages. And I want folks to know no other state's better prepared to do that and keep them safe and healthy than the state of California. Let me thank all of you, and let me also just acknowledge we've seen an 88% decline in Omicron cases just in the last number of weeks, 48% decompression of our hospital system. Now is the time to move forward, to turn the page, maintain vigilance. The smarter plan, we think, is a good and appropriate pathway to do just that. Again, I want to thank all of you that were here to help us with this plan, and we look forward to updating and adapting to the changes in store. Thank you all very, very much.